Hi, it's Dr. Scovazzo again and Professor Anderson from the Canisius PA Studies program. We're going to be showing you during this video how to use a triangular bandage to create a splint for someone who has a forearm or wrist injury that looks like it might be a break. So what you're going to start is have the injured individual start by putting their arm close to their body and using their uninjured arm to support it. A lot of times when you have an injury to the forearm or the wrist, it's less painful to have them just hang it down. However, that's going to promote swelling to the area. So you want them to hold it up with their other arm so that they're not in a lot of pain while you're trying to do this. As you can see, this is a very large bandage in a triangular shape. It's important to know that the tip of this triangle is going to be facing the injured side. So it's not going to be like this, it's going to be facing the injured extremity. You're going to start by gently coming underneath, having them lift up their arm and bringing the tip of one of the triangle here. And you're going to have them come back down and rest. And then you're going to bring the bottom point of the triangle up over their forearm. And then when we come to the back, you're going to tie the bandage in a ring knot, essentially to secure it. You could take the ends and tuck them in if you'd like. You can let them hang. And then we're going to go back over to the point over here, and if you have safety pins, you can go ahead and safety pin it after you twist it. We don't have one right now, so you're just going to go ahead and twist it, and then you can just tuck it in to keep it secure. You can see that the arm is now supported all the way through the pinky, so it's helping protect the wrist and the forearm, and now this other arm is free to use instead of supporting this because it's in the sling. This video, we're going to show you how to do a figure of 8 wrap for a wrist sprain. So you're going to start with having whoever is injured hold their hand out for you and have their thumb out in an L shape so that you can get around it. You're going to start near the thumb, and you're going to come down, and then you're going to give a little tug to give some support, and then you're going to come up and around. So this is where we're going to start our figure of 8. We're going to go over and around behind the wrist, and then we're going to come down and repeat the same thing. As we move, we're going to advance the wrap about 1/4 inch at a time, keeping it under tension to provide support to the injured area. And once we cross that joint line, which we have done here, we've crossed the wrist, we're going to move from the figure of 8 pattern where we were going down and around to what we just call a spiral pattern, and keep advancing the brace up. Again, we're applying some tension here so that there's support to the injured area, and also so we can help control any swelling. But we don't want it so tight that the fingers are going to start to go numb and tingly. There should be some mobility when you use an ace wrap to the joint. It's where it differs from something like a cast or a hard splint. So you can see that she can wiggle her fingers, she has some motion at her wrist, but there is some support to avoid excessive motion of the joint. Hi, it's Dr. Scovazzo again from the Canisius PA Studies program, showing you guys how to do the figure of 8 ankle wrap. This is what you would use if someone were to sprain their ankle to help stabilize it and control any swelling that they might get. So you're going to start with an ace wrap. You're going to have start on the outside edge of the foot here, come down and around just under the toes, and when you come up, you're going to give a nice tug to anchor yourself. This is where we're going to start our figure of 8. So we're now going to come up and around the back of the ankle, and then we're going to come down and around the front of it, just in an 8 pattern. And as we progress, we're going to continue this motion until we're all the way across the ankle joint, and we're going to advance the wrap about 1/4 of an inch at a time. And we're wrapping so that we're keeping it nice and snug to provide support, but we're not going to go so tight as to cut off any blood flow to her toes here. So now that we're across the ankle joint and it's covered, we're going to progress into what we call a spiral wrap, which is just circular. Gotta get our Velcro free here. And when you get to the end of your bandage, you just adhere to it. And you can see that we've got the whole foot covered here. We've got some stability, but she can still move her ankle. It'll help provide support and get rid of any swelling that she has associated with her injury.